And I wanted to welcome the newest addition to the White House Coronavirus Task Force, Dr. Scott Atlas, to further discuss the pandemic. Hi, Dr. Atlas. Thanks for joining us this morning.
Okay, thanks for having me.
So first off, I want to ask you this. Critics have been saying that you serve as a counter to your colleagues, Dr. Birx and Dr. Fauci, because your views on the virus align more with the president. So what's your response to those critics that are questioning the influence that you might have on the president, considering that you're not an infectious disease expert?
Well, there's a lot of things I'm not. I think my wife can verify that. But the reason I'm asked is because of what I am. And, you know, what I am is someone who's been in high-level academic medical science for 25 years, integrating a lot of complicated information from multiple subspecialties like infectious disease, pediatrics, oncology, cardiovascular medicine. I mean, I'm pretty comfortable with my CV there. And I also have 15 years of experience at a very high level, a public policy institute working on healthcare policy. So the president asked me to help based upon my experience. I'm not asked to be a virologist or an immunologist. I'm asked to be a health policy person, and I hope I can contribute doing that.
And it's something that's not unprecedented. I know I've heard from Obama-era officials that weren't necessarily a specialist in a certain field when they were asked to come on and, handle the H1N1 pandemic. So that's something that goes along with what you're saying as well. You're also a proponent of this controversial herd immunity strategy, though, to gain a hold on the pandemic. It would essentially entail allowing the virus to spread through most of the population to build a resistance to it, but taking steps to protect people that are vulnerable, like the elderly in nursing homes, for example. Are you currently actively working on any policies that would work towards that goal?
Okay, this is just another, unfortunate thing that I've learned here being an outsider coming to Washington, D.C. I always realized that the press is biased. I never realized they published overt lies. And the fact is, I have literally never advocated a herd immunity strategy to the president. I have never advocated a herd immunity strategy to the task force. There has never been a presidential interest in a herd immunity strategy, to my knowledge. What we're doing here is we're doing what every rational person would do who understands what's going on. And that is, number one, doing everything we can to protect the high-risk vulnerable here. And we're increasing that protection. I mean, we've done fairly well, but, you can't deny it's been imperfect because no one in the world has done perfectly at protecting the high-risk vulnerable. It's extremely challenging. Point number two is we're trying to have a policy that hospitals are not overcrowded so that other people with serious illnesses can get medical care, and we're doing pretty well with that. And point number three is the president understood from the beginning that the cure cannot be worse than the problem, is the exact quote he said. And that means safely opening society and safely opening schools, particularly because there are enormous harms from a prolonged lockdown. There's nothing controversial about that strategy, and it's really simply an overt lie, really, to say that there's some other nefarious strategy going on.
Well, and thank you for touching on that and clearing that up, because I have seen a lot of reports that mention that. Finally, Doctor, we've heard from Democrats on the Hill. They're alleging that the president is using the promise of a vaccine before the election, putting political pressure on the FDA, the CDC to issue an emergency authorization for treatments that still need trials. That's their argument. The White House is denying these claims extensively. But just to play devil's advocate here before I let you go, has the election ever been brought up during discussions about the pandemic?
I have never heard any kind of pressure. I mean, this is just another sort of game being played by. It's unfortunate because what they're doing in the media is actually instilling fear in the public. There is no safer FDA than the United States. There is no safer drug development or vaccine development than in the United States. And as an American, you really have to have very much confidence in this. There are zero corners being cut on these things. I've seen the discussion. I'm not an expert on the vaccine production, but I hear what others are saying at the task force table and otherwise about what's going on. I would say this: only in Washington would be a news item like a rapid development of a vaccine in a pandemic. Only in Washington would that be bad news. That is simply, absurd. We have there is outside blinded data analysis being done that has nothing to do with the administration, and nothing will be done unless it's both safe and effective. And I have complete confidence in the vaccine development here, and I think you would really be foolish to think otherwise.
All right, White House Task Force member Dr. Scott Atlas, thank you so much for joining us today and clearing some of this up. We certainly appreciate your time. We know you're a busy man. Thank you so much again.
Thanks for having me.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube. And call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.